Hey Sparkles! I'd start in 30 seconds, so I'm gonna start the stream after the ads, which is about in a minute. Thank you for waiting. Oh wait, 1 sec. I forgot to turn on studio mode. No one saw anything. I'm crying, your engine mode is crazy. Oh, that's just NCS. Some things. Else. Oh wait. Okay, welcome back guys. Give me a second. I'm trying to fix something. Okay, fixed. Hi Sparkles, welcome to the stream. Hi Clever, hi Mocha, thank you for taking my first for today. Clever, let me reduce the music real quick. Okay. Thank you guys so much for waiting. And I'm so sorry I couldn't stream today morning. I was just feeling... it just doesn't feel right. I don't feel like streaming much during the day. I don't know why. Maybe because it's painful setting up the hand cam because it's fucking broken. Anyways, no hand cam from today because we are grinding Qbanks. And yeah, this is just NCS music. I wanna play some good non-copyrighted music, but YouTube says no. Anyway, thank you guys so much for joining my stream. Let me reduce the music on my side. It's too loud for me. Okay. If it's too loud for you guys, please do tell. I'll reduce it further. And oh my god, Clever. 20 times? Crazy! He's on his way to break records right now. I think he already did. I don't know. I feel like Juice has... I mean, I can only tell if Juice shows up in chat, but I think Juice has a 90-day record or something, which he kind of... I don't know if it's still there. I don't know if that streak is broken, but he did have 90 days once. He can confirm. Anyway, let's get to studying. So today, I'm planning on doing my first year subjects on Qbanks, like NAPT, Physio, and Biochem. Now, I did not really go through Physio and Biochem. I just skimmed through the last week, so I'm gonna be really bad. Be really bad, so I'm not gonna trust on my scores. Because that's what the Qbanks are for. We are gonna find improvement every time we solve a question. So by end of the day, I hope we have some improvement, or by end of the next week, because that's my deadline. I have my exam next Sunday, and I'm so fucking nervous. Probably why I can't sleep every night. It takes till 3 a.m. for me to fall asleep, like almost 1 to 2 hours, and then I wake up very tired. So that's one reason why I don't really stream during the day, even though I put in my schedule. But tomorrow, let's see. Tomorrow, I did not put a stream on my schedule in the day, but I think I will be solving question back anyway, so I'll try to stream it. Let's see how it goes. Anyways, let's get to it. Welcome, guys. So I'm just saying. Do we need aims? Do we need to... I forgot to make a Twitter post. It doesn't matter. Recent updates. Wait, I don't want... AIMS has a lot of these controversial questions and question types which are not repeated in it, which I want to avoid, but it has good information that could be asked in NEET. What's eponyms? What is eponyms? I don't want to put every fucking tag like we always do. I want it to be specific to the exam. Okay, I put them as like discovery and yeah, it might also controversial now. Drug of choice, criteria, yes. Instruments and slides, what would be okay? We can skip just base. I think pretty much everything here. I don't want to include untamed, could be random. Let's set the questions to 20. We're gonna do 20 because it helps us start concentration. And we can get repeated questions, which is actually good for us because repeated questions, please. We make sure we don't do the same mistake again. And if we do that repeated question correct, then the next time it comes in the exam, it might come in the exam, you never know. And you know that you repeated this question 2 to 3 times and you know the answer to it. That's why I'm putting 20, because if I put 100, they're gonna try to put 100 non-repeated questions, which I don't want. So all MCQs, question bank MCQs, bookmark, and grand test. Yeah, put all. So let's generate the module. Something went wrong, please try again. What the fuck? Shut the... Ah, I just realized. Q. It's September... Lol. You know, I just love it. My logo is covering the my name. Cause yeah, this website loves to dox me, so I realized I have a logo covering my name. I just realized that website was trying to dox me. But hell yeah. Yours is September 17th. Oh my god, good luck. Oh my god, we have to set everything again. Choose 10, 20. An ad by physio. Choose aims, numbers, the comments, problems. Image-based, recent updates, no controversial, need investigation. Drug of choice, criteria, instrument, slides, political. They don't ask Jeff-based. What the hell? What the hell? Question mark is for pro users only. Oh my god, I got kicked out of the subscription? No. I had the subscription till yesterday. Actually, I had the subscription till today morning. Bruh, give me back my subscription. No, what's this awful timing? Let's see, I need only Qbanks and test series right now. Do I need videos? I don't think I need videos. Nah, I don't need videos. I already have all the books I need. Oh crap. Give me a second, guys. Let me purchase. Okay, let's see what I'm changing the plan because I had a different. Hi, Zaki. Welcome to the stream. Are you done with yours? So MCQs, magic modules, recent updates, updated schema, 390 plus total test, pan India mock test. Yeah, I think pretty much what I need. Yeah, let me just quickly buy this. I lost all my will to play League. That's an average day of playing League now. Oh my god, I'm spending too much this month. I spent 10k for the chair in rupees and now 7k for this. Okay, done. Okay, done. I bought it. I bought the plan. Now let's do it. That's why it was showing an error. I was like, I think it just went out of subscription. Because it was showing error, it was not even showing you're not subscribed. I legit don't know what I do wrong. Exactly, that's literally how low elo is. Sometimes you just don't know what you enjoy. Sometimes it's just you, sometimes it's the entire team. You may never know. At this point, I just want to stay away from League. The next 1 week, no solo queue, only ARAM if I feel like it. Tomorrow, maybe we're gonna do ARAM night, but no fucking solo queue. For the next week, I need to cleanse myself of the League addiction. Hi, Sleepy. Welcome to the stream. He's gonna sleep now. Yeah, that's literally in your name tags, Sleepy. He barely exists anymore. He goes into hibernation. In I don't know. It's not in winter. Who goes into hibernation this time of the month? This time of the year? Wait. I feel like we added something we were not supposed to. Yeah, I think that's it. No. The thing is, I don't understand what I'm doing wrong. Watching my replays, I learn mistakes, I fix them, start doing, and then lose that again, without falling back on my mistakes. Yeah. See, the thing I realized is the only way to not make that mistake is, I don't know, League is an instinctive game. You are relying a lot on your muscle memory more than using, like, you know, when you're micromanaging things. And I'm not talking about macro. Macro, you do use your brain, but when you're taking trades and shit, you're relying solely on instinct. You don't think. You have to rely on instinct. The more you think, the more you're gonna fuck up. The more you think, the more delayed you're gonna do, and the more fuck ups are gonna happen. So it's so instinctive that it's gonna be hard to learn a mistake made by muscle memory. That's gonna take a hell lot of practice, because you will make the mistake no matter what, again and again and again, because it's solely muscle memory. You're not thinking. You're not gonna think before doing a trade, or when you're doing a trade. You're relying on instinct. You're relying on how your hand moves against your opponent. So that's gonna take a while. Like, my CS was the problem, fix it, started winning, and then started losing a lot, and then realized my roam time was shit. Started losing by this. It's mind boggling, yeah. And one more thing I noticed, there's so many fucking champions in the game, and yeah, you every matchup plays out differently. Every matchup, the game goes differently. Maybe you're stuck in lane for a little longer in some matchups. Maybe you're stuck in lane. Maybe you roam a lot in some matchups. Maybe you're not good at some matchups. Maybe you haven't played much against some matchups. Maybe you just suck at playing against this matchup. Maybe you're too good at playing some matchups that you underestimate them. There's so many, you know, how do I say, probabilities, alternative futures, alternative probabilities, like League. It's gonna take a lot. It's gonna take an entire summer camp, boot camp pig kind of thing to actually improve yourself quickly. Like how Pace did with his mentor. His mom hired a coach for his entire summer holidays just for him to climb out of Diamond to Challenger and join a pro play team. And guess what pro play team he goes to? Genji! Holy. And he actually is... He actually carried Genji, like the first year or whatever. His rookie... He had one of the best rookie years ever, honestly. So most probably mid-lane again. Also, mid-lane game mostly involves, like, mid-lane game is a part where you're out of your lane. It's no more about you and your solo skills. It's about how your team plays out as well. Because you're playing something like Auction and Log, which needs, I don't know, some of our team. You can't 1v5 with a Log, or maybe Auction, but Auction is too squishy. You need a team, and it still depends on how your team goes out. And then, like, if you have a 130 bot lane, I don't know how to get out of that one even now. You can win with both. I don't see how you can. I don't know. Imagine there's a Nasus coming, these 10 kills, and you don't have a team. I don't know how. I genuinely don't know how to win that with a lock. It'd be just painful. I don't even watch. It's just painful. I just permaban Nasus from these days. He's just everywhere. I think I just haven't learned how yet. I don't know. Plus, there's some good. Not just that, there are some good days in League. There's some bad days. There's some good days with their hand. There's some bad days with their hand. It depends. Because some days I just feel like my hand doesn't move as much. It's like frozen in place. Yes, I'm blaming my hand for losing that. But I know it's my mistake because, you know, my hand gets all tingly sometimes for no reason. Hi, Hyper. Thank you for the check-in. Oh my god, he's 25 times. I thought Clever was close. I thought Clever was first. I forgot Hyper is beyond 20. Holy. Okay. Okay, we are grinding. Yeah. I mean, you are an action OTP. You should be good at lane. There's no doubt about it. I'm a Yorick OTP. I don't know. I can't say good at lane. So bad. I mean, yeah, he's pretty much late game, but yeah, I don't int with Yorick, so I never inted with Yorick. Never is an understatement. But anyways, let's start starting. I wanted to create a custom module. It's great. Rennie, I did not choose stuff. Choose unad biochem physiology. Choose everything. Wait, all minus. Can I? Never mind. Problem image based recent. No contract issue. Growth choice criteria. Instrument slice critical. Generate module. Item, but I wouldn't consider myself OTP because I can play other champs. But do you play other champs? I can play other champs. I can play a lot of champs, but I stick to Yorick most of the time at least. So that considers someone. Every time you stream, I only see you playing Action or Log. That pretty much makes you an ODP at this point. And ODP is good. I'd say sticking to a champ till Masters is actually good. I mean, what I was saying is that what's this you doing? I'm doing a question bank. Like custom modules for, I don't know, 100, 200 questions, how much you can go to. So I was saying that, what I was saying? What was I saying? Okay, yeah. Okay, even I play a lot of other champs, but ODP is not, you know, ODP is not about, you know, just playing a champ. It's, I mean, I've seen ODPs who are really good at other champs too, but they stick to that one champ and they grind with one champ. I've seen you do that. I've seen you only play Lock or Action and just use those two champs to grind Rigged, especially on streams. So that's literally what defines an ODP at this point. There's no other definition for it because ODPs do play other champs. It's not like they only play one champ for their entire life. Most OTPs are shit at other champs. It depends. It depends on most people. I'm a Yorick ODP. I can play any Yorick build you give me, but I'm good at. Okay, I'm okay at Shetión. I'm really good at Galio. I'm really good at Seraphine, but I like to play Yorick ODP. It's just that some 1 or 2 days in the month, I just feel like playing another lane, and I know the champs from ARAM anyways. And it's all about how much you have played the champ over the past 2 to 3 years. Because if you're playing a champ way more than other champs, and you're truly only grinding solo queue with that one fucking champ, that's literally what makes an ODP. Because you can't expect me to play Yorick in draft or Swift play. I just pick another guy. I just pick another champ. That's why Yorick, because Yorick is my solo queue champ. I do not play Yorick outside solo queue. Even ARAM, I sometimes pick it in the champ. Who's truly good at other champs. So you don't have to be good. You just, I mean, ODPs like to have fun too. You don't have to be good at a champ to play it. So you're an ODP, you're an action ODP, because for the past month, I've never seen you touch another champ apart from ARAM, which you played like once with me. I've only seen you play action and lock on solo queue. So that's literally what an ODP does. And you don't consider yourself ODP. I don't know who's considered an ODP at this point. Like example, you take Boss. He used to be a side OTP, but he also plays Gracchus. Then he shifted to other champs. He plays a lot of champs, but he's known for his OTP Scion. Then there's XP with the Singed, but he also plays Malphite. But he's known for his Singed plays. I played way more Inavity than that. I'm just saying. You take UB is fucking. I've never seen UB play anything beyond Yorick. Yeah, I don't think UB has played anything beyond Yorick. What the fuck does he play apart from Yorick? I don't know. I did start playing Kayle again. But it's so rare. It's so rare to see you in a Kayle match. I've seen you like once maximum. And I'm not even sure if I saw you once. Is it just my head or did I actually see you once? I don't know. It's not counted since you have way more significant. Imagine like 80% of your solo, at least 80 to 90% of your solo queue games are one champion. That's literally already at this point. And I don't know, I migrated to mid to play action. Well, yeah, exactly. You wanted to ODP action and you went mid. Nothing wrong with that. That's pretty much what an ODP behavior is. I play Yorick top. I play Yorick jungle. I play Yorick mid. Not always mid. I don't know. I'm not really good at him mid. It just feels boring to play him mid. He's one of the mid champ kind of guy, you know. It's all about poking, and mid. And asking the opponent jungle to piss off. And taunting them. Yeah, top is better. Top is much better. But I feel like focusing on jungle Yorick more because I have a disgustingly high win rate on jungle Yorick. Imagine grinding in versus code while your stream is playing in the background. Crazy. Imagine grinding code at this time of the night. I wish old auction was still a thing. Then I would play auction top more. No, I will fucking report here on stream if you ever played a range top later. Kayle is fine. Kayle is fine. Not any other range top player because Kayle is worth a scaling range because you have a melee range early where she gets abused so badly. Range top players should not go top. You got first, yeah, clever. Let me just add it so that you don't have to keep yapping about it. First. One second, let me... Is that a 1 or is that L in the end? Clever 1 or clever L? Because the last time I tried to type it in, somehow it screwed up. I don't know. That is an I1 L. It can be anything. Tomorrow you're going to Wonderla? Good luck with the waterborne infections. I'm scared of going to... I like water sports, but I'm scared of going to public water parks, you know? I do enjoy water parks and resorts because it feels more... It has a more private feeling to it. And there's not much infections that clean the pool regularly. I have seen them clean. But Wonderla is like... It's L. All of it is L. RIP. I don't know. I never went to Wonderla. Okay, let's go. Exceptions of Wayne and Varus. Dude, I'm not crying about top. It's just disgusting to play top. I don't mind play. Oh wait. This has some sort of a timer now. Timing deficiency release and decrease energy production because TPP interferes with. Is a coenzyme for pyruvate and alpha telomerase. Yes. Okay. So I don't mind. Actually, I love playing against range tops. It's just degenerate to play range top. Every time I play against a range top, I murder them. I type in chat. I make the entire opponent team and my team report them and fucking report them after the game, saying they're intent and they're troll. Because that's literally the plight of a range top against a lethality Yorick in the end. Just saying, in the end, It's disgusting. It's stupid. Your top is disgusting. Like, they just meant to troll at the end, because you're just pissing off the opponent top laner more by picking a range job, which top laners hate the most. Top laners hate playing. It's so boring to play against range job. All you have to do is, till level 3, you have to sit back, all the way back. Unlike playing against bruisers, you have to bait it. You can bait at a really small range against bruisers, but when it comes to range top, you have to bait at a stupidly annoying range so that they don't poke you down. And wait till level 3 before you get your E, like before you get your W, then you cage them, E them, and then cage them, and then Q auto them to death. Why bother play after that? It's so boring. And then they just start inting, and then they flip out, and then they blame their jungle. That's pretty much every range top lane matchup I've gone against. The only range top I allow is Kayle, because Kayle plays like a proper top laner. You have to do that most of the time anyways. Like, imagine trying to fire Irelia, Rumble, Renekton, etc. level 1. It's not... Irelia is not that bad to lane level 1. You can touch a minion sometimes. With playing against Irelia, Rumble, Renekton, you can touch a minions 1 or twice. You can get one last hit. I swear, once I got an entire wave against Irelia. Maybe she was just bad. I don't know. She's good. She was good. Level 2, she did how an Irelia plays. You never go in level 1 against Irelia. You stack up this Q. You stack up till Q3. You E then, and then you jump on it open. You just bait them. That's literally how we play Irelia. A lot of people, what they do is they try to go aggressive on Irelia level 1, and they lose out the lane after that. What the fuck? What the fuck? Hi, Eagle. Welcome to the... Thank you for the blur. Welcome to the stream. It depends on who you're playing. Can win 1v1 if she doesn't have stats and you have stat check on her. Irelia is easy to play against. Kind of. Depends on what skill level that Irelia has, though. I remember once the Irelia just kept perma-freezing lane on top towards her side, and it was literally impossible to farm. Because she got a little ahead because my jungle died to her. And yeah, that was pretty much fuckfest after that. She'd killed my ult. I can't go in. I can't push away because I know she's gonna butcher me to death. I try to freeze the wave. She comes. She doesn't do anything. Then the wave slowly pushes towards her, and then she freezes it. She doesn't let the wave push into the turret, no matter how big the wave is. And then I have to go back, get my items, and then yeah, that wave's permanently frozen there after that. She was a really good Irelia player. I have to tell that. I think not just an Irelia player. She was a really good top laner, perhaps. Definitely not belonging in gold. But I think we still won that game. We still won. I got disgustingly fed later on. And she kept dying. I think we still won that game. I think she's played on stream. So what shall we go? Eddie armor tab is 90% range. Also not taking any damage. Exactly. Dude, not just armor, not just range shots, any fucking bruiser. You just build Tavis or Yorick or go Bamble West. 99% of the top laners are useless against him. He doesn't take damage and he pokes. Ghouls do a lot of poke. Not a lot, but you keep throwing those E. Your opponent will be less than half HP for sure. Enough for you to Q auto him to death. We're still on the first question. For how long does the ovum remain viable following ovulation? 40 to 70 hours. Both. Wait. I know this. 24 hours? 24 hours. I think it's 48 hours. Oh, it's 24 hours. Never mind, I'm correct. That was sperm. Where is Sexualized located? Sexualized. Sexualized. What the fuck is Sexualized? Let's see. Let's use our brains. This looks more left. Medial frontal lobe is, I think, broadcast. It's broadcast. Primary artery cortex is not Sexualized. What the fuck is Sexualized? Okay. I don't know what is sexual slurs. Let's look what's there. What the fuck is sexual slurs? Where is sexual slurs? Where the fuck is it? They did not mention sexual slurs here. Okay, I'm a little bad with this table, that's for sure. Okay. The superior temporal gyrus is called the Heschel's gyrus. I should have known that. I just couldn't think. Okay. Which of the following is not a content of cubital fossa? So the median nerve radial. Okay, so content is radial nerve, then the biceps brachii, then brachial artery, then the median nerve. So the bicipital aponeurosis does not exist in the cubital fossa. So let's look at the boundaries. Laterally is a brachioradialis, medially is a pronator cutis, and superiorly is a line joining the median and the lateral epicondyle. Bro, which software do you use to stream? OBS Studio. OBS Studio is just good. As long as you don't update it every fucking time and it somehow fucks it up. The classic OBS bugs. Wait, I might get the coaching because I don't know how to improve at the moment. Dude, Malphite is just stupid. Malphite is like lose lane, win game, add over. Okay, welcome back. Yeah, I just use OBS for streaming, if you heard that. Okay. A researcher looks at an electron microscope image of a sensory receptor and remarks that it is responsible for touch sensation and sustained pressure. Which layer of the skin contains the receptor? So epidermis, dermis, and chita. So we're likely talking about a sensory to receptor response. So it has to be the epidermis now. 1? Oh, it's 4. What the fuck is 4? Ah, they fucking marked it. I saw it here. I did not look. There was a 4. So I didn't see that they actually divided the skin further into stratum, corneum, granulosum, and all that. Okay, so it's the Merkel cell. Merkel cell is found in the stratum basis. So stratum corneum, stratum lucidum, stratum granulosum, stratum spinosum, stratum basis all the way at the bottom. So stratum basic contains Merkel cell, which contains the dendritic sensory cells responsible for touch sensation. Hi. What did I call you? Gatives? Gatics? Punjabi accent? Oh, I'm not Punjabi. What the fuck? Punjabi accent is lost like this. But you're like, hey, balle. I can't do a Punjabi accent. I'm so bad. Oh, what are you doing? Yeah, that's pretty much how Punjabi is. I could do that more. It's kind of entertaining. I remember having a Punjabi guy in high school who always used to bring Coke for lunch. Well, not the powdered Coke, the Coca-Cola. He used to bring a can every day for lunch, and he never shared. He never shared with anyone. He's like, "This is mine. I'm gonna drink it." We should have channel ready with different accents, with different Indian accents. I could do a Tamil accent. I could do a Telugu accent. I don't know. What kind of accent did they have exactly? I could do a Punjabi accent. I could do Bengali accent is pretty much like like hyper. Like they add all for everything. What are you doing? Wait, it sounds weird. They changed every with the all. They add all for So anything that says a they still all. They go with a o sound. They wow. I mean, I could get a coaching for like $14. I don't know. I just don't feel like, unless you're really serious about getting to masters, is coaching really that worth it? I mean, that's stupidly expensive sometimes. Sorry. I didn't. I need to learn how to do a Bihari accent from my friend who's in Bihar. Yeah, she would have seen enough Biharis to know the accent, I guess. Well, Mumbai is just a fucking American wannabe woman trying to do some weird English accent. Like, oh, I don't know, but you know, this is like, this shit is like, It's kind of sad. I don't like this. That's literally how Mumbai people speak. It cringes me out sometimes. There's a really weird bug upside down on my desk, and I'm just watching it suffocate. Let me just kill it real quick. Mercy. I don't want the bug spawning babies in my room tomorrow. No, I put it upside... It was upside down, then I fixed it while trying to kill it with my pen. Okay, it's dead. Hello, ma'am. This is John Pork from Microsoft. How can I help you today? John Pork? It does stream? No way. It's not like I paid 80 plus bucks. I didn't know, brother. I live in India with like the worst possible US. I don't know. It's like $1 is 100 rupees. I think more, less 90. It was 96 the last time I checked. Probably it increased. So yeah, everything is overpriced. Especially euro is really overpriced, and I'm a need. I don't earn, so anything the online people offer me is like way too overpriced for me. Jeffrey Epstein. Why are we talking about Jeffrey Epstein? There's no pedophile in here. Except you, probably. I don't know. I don't go into your... Oh my god, his butt. Okay, the parents also complained of early breast development, growth acceleration, and vaginal bleeding. It was found that she had a gain-of-function mutation in the G protein. Okay, so she had early breast development. She had growth acceleration. So... yeah, so unlikely colorblind. Colorblind is usually in males, so that's stupid. Hirschsprung disease. Hirschsprung disease now. Hirschsprung disease? Nah. Familial hypothyroidism. Did they mention anything about hypothyroidism here? I mean, growth acceleration you don't say on hypothyroidism, so it's McCune-Albright syndrome, pretty much. That's pretty simple. So let's see. McCune-Albright syndrome is gain of function of G protein. You have skin pigmentation, hypercorticism, fetal creating a mosaicism of normal and abnormal cell. So most of them are loss of... Usually it's all loss of function mutisms. Like, see, Hirschsprung disease is a loss of an... 1 second. So Hirschsprung, they're gonna mention aganglionic microcolor. It does not happen in that age. It happens in a really small age. So it's really the options were just bullshit. Colorblind is loss of function mutation, but they said specifically said that women happens in males. It never happens in women. Never is never. There's one case where it's never. A baby. Wait, I may be wrong. Wait, hold up. It's Y-linked. Colorblindness is Y-linked. It's usually more. It's usually in male. So I can't say it never in medical. So I'm gonna retract the statement. It could. It's not genetic colorblindness. That's what I want to say. It's not Y-linked colorblindness. A baby is being evaluated for delayed developmental milestones. On examination, the child has hepatosplenomegaly. A microscopic image of is shown below. What is the diagnosis? So the patient has, okay. It's either Niemann-Pick or Tay-Sachs, but which one has? Okay, it's Niemann-Pick. Never mind, it's Gaucher's. I don't know which one had the hepatosplenomegaly and which one did not have the hepatosplenomegaly. Okay, so Gaucher's for giant. Gaucher's, remember Gaucher's for giant. Giant means hepatosplenomegaly. So Gaucher's has hepatosplenomegaly, whereas what are the other options? Niemann-Pick. Niemann-Pick does not have hepatosplenomegaly. Well, let's read about the others as well. Hunter disease. So I was not sure if it was Gaucher's. I said taste size, but I was not sure reading Gaucher's and Qbanks. I'm live right now streaming your stream. What are you doing streaming my stream? You're accidentally live by accident, lol. So Gaucher's have wrinkled paper appearance, pass, positive. Acids, Qbanks, acids, finger autosomal recessive. Okay, type A does not have sphenomegaly. Type B has sphenomegaly. This is kind of confusing. I don't know. My other book said otherwise. Hunter disease is X-linked inherited disorder. Iduronate sulfatase. Accumulation of dermatan heparin sulfate. That means there has to be some skin lesions. So yeah, coarse faces, distinctive skin lesions, cardiovascular involvement. Since there's heparin sulfate, yeah, there should be a heart involvement as well. Hurler-Sheikh disease, cognitive degeneration. Okay, the fibula ossifies from how many ossification centers? So fibula has 2, no? 3? Okay, that's 2 secondaries. Oh my god, yeah, it does have 2 secondaries. Why didn't I? Never mind, I'm stupid. So there's 1 primary in the center and there's 2 secondaries at the peripheries. So always remember ossification goes from proximal to distal. My brain is not functioning at the moment. What the fuck? Okay, fibula defies the rule of ossification. Right, we need to type rules of ossification in Google. Important. Okay, primary center appears before birth and usually second. Second law states that secondary appears after birth, usually multiple centers. Third law centers appears first, fuses with the main, with the diaphysis. Secondary centers fuse together before joining the primary shot. Fifth, the nutrient artery of a long bone may points away from the primary, growing. Okay. So it does not say anything proximal to distal. Okay, maybe that's just development in general. That's just growth and development. Okay, a patient with a cerebellar lesion will show all the following except, so he shows nystagmus, ataxia, yes. Past pointing? What's past pointing? Resting tremor? No. That's Parkinsonism. How many grams of NaCl make 1 mole of NaCl? 57.5, 58.5. What the fuck? Okay, this is chemistry, guys. This is chemistry. I'm not a chemist. Hold it. So 1 mole of NaCl is 58.5. In this case, a molecular weight of Na23 and Cl 35.5. I forgot. So basically, I completely forgot there's something called molecular weight. And I kept thinking about the normal value of sodium in the body. And I was like, 23 isn't supposed to be like 135 to 145. What the fuck? Okay, this is chemistry. I'm not gonna be asked chemistry. But remind us, goodness, they're stupid. Which of the following structures form the angle of antiversion? So there's antiversion and the antiflexion. Antiversion, V for vagina, and wait, I think it's uterus. Uterus in the vagina is antiversion. Never mind, sorry. I know there's a vagina in it. But they said uterus and bladder. I should read the question more. I know V for this is how I remember. Version for vagina. So yeah, there we go. Cervix and the long arm of vagina, and uterus and cervix is antiflexion. So there's no V for flexion, so it's not V. I gotta go, by the way, gotta pick up Paula at the shift. Okay, bye, Zaki. Molecular weight was like class 11. I finished my class 11. 9 years ago. Wait, 9? 2018? 8 years ago. Yeah, 8 years ago. I finished my class 8 years ago. And I studied 19 subjects that did not involve chemistry. Almost. Biochemistry is not technically chemistry. I just learned for that I have to go. Okay. Which of the following is the best screening for metabolic disorders? So we're talking about metabolic disorders. So it's not it's all vestibular or tandemous or gel electrophoresis? Tandemous. Why did I say gel electrophoresis? Yeah, my brain is so not. My brain has to. I have to pick up. Okay. The mouth structure forms the medial wall of which of the following? Corpus callosum. Third ventricle. Lateral ventricle. Oh my god. Gotta grind virtual study code. Okay, hyper. Enjoy your virtual study code. Concerning the circuitry between mossy fibers, climbing fibers, and cells of cerebral cortex, which pairs provide excitatory input? So I know it's not. Oh my god, this I knew this. I think it's the granule cells and the mossy fibers, yeah. Because G for granule, G for glutamate. That's literally how it works. Glutamate is excitatory, so there's one more G is granule, which is and Golgi rhymes with GABA. It doesn't rhyme, but I assume it rhymes, which is inhibitory. So let's look into it. So climbing fibers exert a strong excitatory effect on present. Mossy fibers exert excitatory effect on granule cells. So the excitatory cells are climbing, mossy, and granule, whereas the basket cell, Purkinje, and Golgi, or we call it BPG, is inhibitory. Now identify the area marked A in the following. So we're looking at the medulla. This is the vagal triangle. I forgot. That's not the facial colliculus. It's not the facial colliculus. It's either the vagal or the hypoglossal. It's a hypoglossal triangle. I can rule out. I can get up to 2 options. So, okay, I forgot the diagram. So this is the pineal gland. Okay, superior inferior colliculus. Where's the? So we read it last week on stream, right? I went so quickly. So the medial is gracilis or lateral is cuneatus. So this is the hypoglossal triangle. Where is the vagal triangle? Okay, the outside one is the vagal triangle. Oh my god, this is why I hate mnemonics. I was like, the vagal triangle looks like a V, and I was like, oh, that looks like a V. It's not. So the vagus nerve is after hypoglossal. Wait, no, hypoglossal is after. Oh my god, how do I remember this? I need to find a way to remember this. I feel like I'll end up remembering it because trying to find a way to remember it. So V comes after H. So H is inside, V is outside. Simple. Next. An enzyme Kx catalyzes the following reaction based on this. What class of enzymes does? Okay. So fructose 1,6 bisphosphate broken down to DHAP and G3P. So this is a hydrolysis. Okay, where is the reaction happening? So the reaction happening somewhere here. So you break this in presence of water. Hydrolysis. No, it's lyase. What? You don't know water? Oh no, there's no water in it. Yeah, no way I'm remembering this. A patient, I just need to use common sense. There is no water. They didn't write water. Why did I take hydrolysis? They did not take water. They did not put any H2O molecule in it. A patient with myasthenia gravis was suspected to have a thymoma and a lateral chest X-ray. What will you expect the superior mediastinum? That's where you see a thymus gland, superior mediastinum. Which of the following is the common intermediate in the biosynthesis of triglycerides and phosphoglycerols. So it's either acetyl-CoA or acyl-CoA. I just don't know which one. I'm gonna go with acyl-CoA. Never mind, it's phosphatidate. Oh my god. So common intermediate biosynthesis is phosphatidate. Acyl-CoA combines with G3P from 1,2-7. Okay. Contributes phosphate at the formation of phosphatidylinositol. Okay. I hate biochem officially. Middle-aged obese woman had elevated liver enzyme on routine follow-up. A USG showed grade 2 fatty liver. She is non-diabetic. Yeah, I don't fucking give a shit about the score right now. I'm making silly mistakes. Maybe I don't know, but we are learning. We are learning. We have 1 week left for the exam. We need to finish a lot of questions. So we have a middle-aged obese woman with elevated liver enzymes. USG shows grade 2 fatty liver. She's non-diabetic, non-hypertensive, and she has basically no carbs. So what is the pharmacological treatment for this patient? What do you mean? The relationship between flow in a long, narrow tube, the viscosity and the radius of the tube is like Fick's law. Never mind. Viscosity, Poisson is physics. Physics! So it must be physics and chemistry! They asked physics and chemistry. I tried at 60%, but they asked physics and chemistry. Wait. There's no 25. There's no option for 25. Why is there no option for 25? Questions. Yeah, I don't want controversial. It just confuses you more. Which of the following is a diluting segment of the kidney, the loop of Henle? Yeah, it's a descending. Oh, it's ascending. Oh my god. Oh my god. Which I knew it was a loop of Henle. I forgot the ascending or descending. Oh my god. I need to go back to the basics. Oh my god. What is the blood pressure at the end of normal inspiration? I don't know. -6, 0. Oh, nice one. 0. I said 0. So I need to take the first thing I'd say. That's usually the correct answer. Family consumes only polished rice. Which of the following combination of vitamin deficiency and enzymatic defect will be present in the family? So you'll have a thiamine deficiency for sure. And enzymatic defect. Transaminase. Transketolase, interesting. Okay, so cofactor of transketolase. That's what. Okay, this is one table I need to know. Yeah, and I'll take a picture of this. I definitely need this one table. And I send it to my other account. I'm just gonna send it in the group. Never mind, I'll send it to my other account. I'd be weird sending some random biochemistry question in the group. Okie dokie. So let's see. Thiamine is transketolase, pyridoxine is transaminase. Oh my god. B6 is transaminase, riboflavin is glutathione reductase. Okay. Folic acid is picluastidine. Cobalamin is uromethylmalonate level. Now, what do we have here? This is an appendix. So he's having appendicitis. You suspect inflammation of the organ. What is the most commonly? The most commonly is posterior, no? Wait. It's actually 2. Yeah, it's 2. So we have retro. This is the pelvic, yeah, it's pelvic. Most common is retrocecal. Yeah. I said posterior, but yeah, that was retrocecal. I knew the picture. It's behind the cecum. It's retrocecal. That's the most common. Okay. Young lady presented with a tingling sensation in legs and hands. On examination, she had fissured tongue, lips, and lesion at the angle of mouth. So we are likely looking at lutein B2 riboflavin. Yeah, she had angular cheilitis. I was like, yeah, this has to be riboflavin, right? Because I always made the mistake of B12 having accumulated B12 having angular stomatitis, but it was actually always B2 riboflavin, and this is why I fucked up a lot in biochemistry, confusing water soluble vitamins because of this. And thanks to my mom, confused me. My mom, ever since I was kid, she was like, "You have angular cheilitis. You have B12 deficiency. It's just B2. It's B2. You give me a B complex. You're not giving me B12. You're giving me a B complex. Oh my god, battery died. I have another spare. I have another battery." A 70-year-old hypertensive patient was rushed to the casualty following a transient ischemic attack. Angiography reveals stenosis of the IC, which part of this artery does not give any branch. Okay. Cervical part does not give any branch. It gives us an inflammation, no? Mine doesn't. Yeah, cervical does not give any part. Simple. Petrus gives the artery to pterygoid, peaked for pterygoid, and cortical tympanic. Cavernous gives the runs into cavernous sinus, giving branch to the transverse serous, hypophyseal, and trigeminal ganglia. Cerebral cavernous part gives the rest of the important stuff. What is recommended dietary allowance of vitamin A in a 6-year-old child? I don't know. I don't know RDA. Oh my god. 400. I was right. That was a random guess. Yeah. Yeah. They don't usually ask this. They never usually ask this, but it's rare. Sometimes they do. I have this table in my book, which I never bothered to go through. So vitamin A, children is 1 to 9 years is 400. What did I take? I take 400. Or 390. Male is 1000. So adults is 1000 and children is around half. Less than half. Vitamin D 400, male 600, female 600, vitamin E 10, 10, 12, vitamin K 50, 55. Okay, which are the above perforators known as? Hunters is like, it's not hunters, it's Dodd, I think. Yeah, it's Dodd. Hunter is proximal thigh. Okay. It's below Dodd. Dodd is distal thigh. Below knee is Boyd, and C for calf, C for cocket. So below, B for Boyd, C for calf, C for cocket. A proximal thigh is hunter. So hunters always like to go first in. So proximal is hunter, and D for distal, D for. Okay, easy way to remember. Easy way to remember. Proximal thigh is hunter. D for distal, D for Dodd. Below, B for Boyd. C for calf, C for cocket. Voila. A young man with a chronic... Oh, I've seen this so many fucking times. Dark hair and jaundice. Shut up. Never mind, I've never seen this. A young man with chronic bacterial peritonitis was treated with quatermazole. During treatment, he developed malaise, jaundice, abdominal pain, and dark urine. His blood picture is given here below. What is the most likely diet? I'm looking at... Is that PNH? Never mind. They don't mention anything about the urine. Why did I take PNH? They didn't mention dark urine, but... It's G6PD deficiency. Oh yeah, they didn't mention drug-induced. Oh my god, bite cells, G6PD. Oh my god, I'm stupid. 60 kg adult male has a hematocrit reading of 40% and plasma volume of 3 liters. What is the total blood volume in liters? So it's a 60 kg male, standard, with hematocrit reading of 40% and the plasma volume of 3 liters. I mean, he does just stand, I think it's 6. 5. So what's the calculation? Plasma volume by 1 minus hematocrit. 3 by 1 minus 0.4, which is 5. You know, I'm gonna take a picture and put this in my... At this point, I just... Anything which I'm likely to forget is going in my Discord. Ew. Reduced levels of HDL and APCA1 mutation on exon is shown in the given image. What is the following? So APCA1, 10 years, no? Yeah, 10 years. APCA1, orange tonsils, 10 years. So I remember this Tangy. Tangy is like orangish yellow. Yellow, but orange, but yeah, I say it. Oh, it's easy to remember that way. So, failure to chart, difficulty in feeding, generalized hypotension, hepatosplenomegaly is present. Look at this heart. Agon. Never mind. It's Epstein. I thought it was Epstein anomaly. Child radiograph of the infant is shown here. This is Epstein anomaly. Agon string appearance. But what is deficient in it? What sounds likely to be involved? Epstein anomaly. Let's see. I'm just gonna go for something. Acid maltase sounds right. Okay, so Pompey's disease, acid maltase, autosomal recessive, fair. According to my myogenic hypothesis of renal autoregulation of the artificial arterioles, afferent what the fuck? Why did I say artificial? Afferent arterioles contract and response to stretch induce. I don't know what it is, right? So according to myogenic hypothesis of renal autoregulation. So the afferent arterioles contract in response to stretch induced by nitric oxide. Never mind, opening of calcium channels. I'll let you get a break. So autoregulation has basically two mechanisms. One is metabolic and one is myogenic. They clearly said myogenic. Oh my god, I need to read the text properly. A 40-year-old male presented with diabetic ketoacidosis. After the initial evaluation, he started on IV insulin therapy via an infusion pump. He's at the greatest risk of developing hypokalemia due to rapid insulin infusion. Emotional prosody of speech is mainly a function in which area emotional prosody of speech. What the fuck is emotional singular gyrus? Oh, it's posterior speech. What the fuck is emotional prosody? What the fuck is prosody? Emotional prosody is the affective dimension of speech. Okay, I was close. Singular gyrus is emotional processing. What the fuck is the difference? Dude, oh my god. It's so stupid. It's so stupid. It's so stupid. It's so stupid. So let's read it in detail. Emotional prosody is the affective dimension of speech, including variations in pitch. Oh, okay. Will convey the speaker's emotional state independent of the linguistic content. Okay. The posterior superior temporal gyrus of the non-dominant hemisphere usually involves the auditory perception and... Okay. But isn't that what Broke has this? What the fuck? Oh, that's Broke has in the dominant area, okay. What posterior inferior? Okay, posterior inferior frontal parietal. Interesting. Frontal is Wernicke's. The precentral gyrus involves a PNC in one. Yep. A patient underwent a coronary bypass graft with the great saphenous vein. The patient now complains of paresthesia and sensory saphenous nerve. I didn't ready to read the full question. I just knew what they're talking about. They said paresthesia, saphenous vein. It has to be saphenous nerve. If they said the other side, it's here. No. If the pH is reduced from pH 7.4, the PO2 being constant 100, which line would PCO2 follow? So this is the normal PO2. So we're talking about likely the PCO2 curve. So you say the pH has dropped from 7.4 to 7.3, while the PO2 is maintained at 100. So you're seeing acidic shift. Acidic shift is more likely a right shift of PO2, so a left shift of PCO2. So you're likely looking at 203. 3? It's 1. What the fuck? Shut the... If pH is ready, the following... The concept is step 1, effect of CO2 on ventilation when the alveoli is kept open. When PO2 is kept constant, increased amount of inspired CO2 leads to increase in ventilation. The relation is a straight line. So... yeah... how? I was right about a left shift. The left shift did happen. But... yeah, I was looking this way. This. I don't know. It's confusing. So step 2, the shift of the above graph when PO2 changes. When PO2 change... okay, so this is when PO2 changes. If PO2 drops, then yeah, you're gonna have a left shift, but this way. But if PO2 remains constant, then the entire thing will change. Okay, makes sense. Now, which of the following structures developed from structure marked A? This is the allantois, which forms the medial umbilical ligament. Median umbilical ligament. Okay, I was right. It is the allantois, which distal for sure. Oh my god. Why did I assume urachus and allantois are two different things? I know urachus forms the median umbilical ligament. That's why I did not take it. What is medial? What is medial? What's the rest of the answers? Alright, let's Google it up. Medial like a ligament. Swimming it off. I said medial. This is why I hate AI. This is why I fucking hate AI. I said medial, not median. Bruh. Okay, it's the embryonic umbilical artery. And lateral. Inferior gastric artery and vein. Okay, fair. A newborn has hypoplasia of the mandibles and zygomatic bones, malformed external ears, and slanted fissures. Abnormality of which of the following phalangeal arch 1? Which of the following is appears to be performed by the migration of epiblasts along the primitive streak? First to be formed by the migration of the epiblast on the neural groove. Never mind the endoderm. Okay, I would have gotten it wrong. I would have taken ectoderm instead. I did not see the word epiblast. So the what? I don't get it. Hypoblast is related to the endoderm, right? Endoderm is first to be formed by the migration of epiblast along the primitive streak. So they're not okay with epiblast forming their endoderm. They're saying the epiblast just moves along the primitive streak, but endoderm is the first to form. So yeah, first is the replaces the hypoblast, forming the endoderm. See, so then forms the mesoderm and last to form as the ectoderm and the nervous system. The neural groove is a part of the ectoderm and forms during neurulation, which occurs much later. Okay, that was stupid. Now we have an improvement. We went from 40 to 50. Let's go. We can do this. Let's go 20 questions again. An biophysio. Choose aims, numbers, comments, problems, image space, recent updates, recent needs, drug of choice, criteria, instruments, slides, clinical. Something went wrong. What do you mean? What do you mean? I hope it didn't show that again. It's a pain, dude. I wish they could save our choices, so you don't have to keep doing this constantly. Oh, fucking thank God. Which modification will lead to a change in biological activity hormone given in the following picture? But we're looking at collagen, I think. Yeah, collagen lice. Wait. Change in I think it's 5 to 10, 5 to 6. What is 14 to 16? Tyrosine to... Yeah, this is not gonna do anything. This won't do anything. You have to break among the bonds to change the entire biological activity, which is likely when you're looking at 5 to 6. Not 5 to 6, oh my god, what, 5 to 6? No, not 5 to 6. I really should have dashed in front. No, change in 29 to 30, okay. Why? So the ice insulin. Okay, I was stupid. It was insulin. So the primary structure consists of 2 polypeptide chains A, B, and C. C, you remove it, it does not make any difference. A contains 21 amino acid and B chain contains 30 amino acids. So it has 2 interchain disulfide bonds, 7th amino acid and 7th amino acid B chain, 20th and 19th. 1 intrachain diacid is present. Okay, modification, very short modifications. Between 28 and 29, 28, 29, 3 and 29. Large gene is 31, 32, and mostly it's all 29s. Okay. Next, I hate biochemistry. The pressure volume loop on the left ventricle is shown here. Which of the following shifts the curve from ABCD to ABCD? So the pressure is increasing while the volume remains same. So we're likely looking at definitely not compliance or venous return, increased peripheral arterial resistance, increased contractility. And it was one of the 2 I mentioned, A or C. Because both affect the pressure curve, but okay. Yeah, increased contractility due to sympathetic stimulation. Left ventricular pressure is increased for the same, and that. Okay, the EDV increases as well. Then, not bad. A 57-year-old man presents with pain, numbness, and fatigue of the right arm. Angiography decreased flow to the vessels and is near the surgical neck of the humerus. So we are looking at the third part of the first part of the third part of the axillary artery. Divided by the pectoralis minor. Yeah. What is Meckel's cave formed by? What the fuck is Meckel's cave? Wait, sounds really familiar. Invagilation of the elevator of the false cerebri. Never mind. It's the it's the invagination of the lower layer of the tentorium cerebelli. I should go with the longer answer. So, the frontal mark C closes within how many months after birth? Wait, I had a mnemonic for this first. It's 2 to 3 months, which is B. 9 to 12 months, which is A. It's either 18, I think 18 or 24. Now it's 2 or 3 months. Oh my god. So 3 not 1. I fucked up the mnemonic. I so fucked up the mnemonic. Okay. So the posterior fontanelle and the sphenoid fontanelle both together closes at 2 to 3 months of birth, whereas the anterior 18 to 24 and mastoid fontanelle at first year 12 months. Okay, a man was brought to the emergency after he suddenly came unconscious while working in the field. On examination, his temperature was 105 degrees Fahrenheit and his skin turgor was decreased. Which of the following sweating should not be seen in this patient? Having a heat stroke. Number of cones in retina in millions. I should be knowing this. 15. No, 3 to 6. Oh my god. 6 million cones and 120 million rods. Yeah. Why does it take 10 to 15? Oh my god. 6 million. Okay. Rubber Fresher's law relates magnitude of sensation to... log of intensity of stimulus. I have no idea. So let's say the other laws: doctrine or specific nerve energies. The pathway sensation of which is subterranean, no matter how many. Law of projection: no matter where a particular sensory pathway is stimulated along its course to the cortex, the conscious sensation produced is referred to location of the receptor. The principle is called the law of projection. A man presented with an excruciating headache and double vision. On examination, the following findings were observed. The MRI revealed an aneurysm of the PCA. The affected artery is a branch of... PCA is a direct branch of the internal carotid artery. If the membrane potential of the cell is minus 80 millivolts, the driving force is greatest for which ion? So first we need to calculate. Okay, the only cell is minus 80. So driving force should be positive more for potassium, not mind calcium. What? It says minus 80. I don't know. Let's read it. Oh, okay. Oh, I calculated the reverse. I thought 120 minus 80 you get 40, but negative would just increase more. And oh my god, I'm so stupid. Okay. It's EM minus EX. It's EM minus EX. I will take a picture of this because I'm gonna fuck it up in the exam again. I calculated the reverse, saying 120 minus 80 is 40. 60 minus 80 is lower. Minus 90 minus 80 is minus 170, so potassium has to be higher. But that was the reverse. I was supposed to calculate minus 80 minus 120. Because it's EM minus EX. Where EM is the actual membrane balance, but EX is the equilibrium potential. I fucked it up. You are asked to send a blood sample for complete blood count and analysis of a clinically anemic patient. Sampling from which of the following is preferred? Cephalic or the antecubital? Antecubital. Okay, it's preferred for short-term IV. Okay, cephalic is for short-term IV, whereas antecubital is for drawing out blood. Oh my god. An adolescent male patient presented with a pain in the calf muscles on exercise. On biopsy, an excessive amount of glycogen was found in the muscle, present in the muscle. Which of the following enzyme is likely? So we're talking about muscle debranching enzyme. McArdle's disease. Never mind. Muscle get glycogen. I was still correct. I was still correct about McArdle's disease. But it's muscle glycogen phosphorylase and not muscle debranching. I kind of hurried in there. I did not even read the D option there. Which of the following is an example of secondary active transport? No, non-movement of sodium iodine now. Low transport work in enterocytes now. 100%. Nah, fuck. The area marked in the arrows apply 5 which of the following? Okay, this is going kind of shit. Okay, so anterior, not right marginal, anterior, diagonal. Yeah, anterior ventricular artery. Which of the following is not a component of glycosphingolipid? It says lipid, so it has to be fatty acid, glycerol. Sphingosine, yes. Carbohydrate, no. Okay, it's glycerol. So it's sphingosine, fatty acid, and carbohydrate. Oh my god, it said glycol. A patient presented to the ortho. I need to stop making stupid stuff like this. Ankle sprain causes you to hyperinversion of the right foot. Which of the following ligament? So we're talking about hyperinversion of the right foot. That means the it's not anterior talofibular or the posterior talofibular. We're likely looking at the spring ligament or the deltoid. Oh my god, it's the anterior talofibular. So inversion sprain causes injury to the anterior talofibular. Eversion. Okay, eversion is deltoid and spring ligament. Yeah. My bad. Insulin was administered in a patient with severe hypoglycemia. The drug will stimulate glucose uptake in all the following except. So the patient has severe hypoglycemia. You give insulin. Yeah, it affects the heart. It affects one thing that does not affect. Liver. Wait, skeletal muscle. Which one does not? It's either liver or skeletal muscle. Oh my god. Hexokinase. Hexokinase is present in skeletal muscle, which will take just liver. Yeah, I remember it as there's glucokinase and hexokinase. Hexokinase is muscle. Hexokinase is sensitive to insulin, whereas glucokinase is not sensitive to insulin. Hence, it is affects in the liver. POV, I use my brain. A patient is found to have xanthurenic aciduria, deficiency of which of the following vitamins leads to diversion of 3-hydroxykynurenine towards the xanthine. Oh, whoa. Slow down, mister. Xanthurenic acid. Biotin, no? Never mind, pyridoxine. B6. And B5 causes burning throat. Biotin causes alopecia and dermatitis. Which of the following of cellular DNA is in mitochondria? 10%? 1%? I knew that was a 1. I just didn't know it was 1.1 or 10. 1%. In a patient with decelerate rigidity and applying pressure on the footpad extension of the lingual, which of the following statements is false regarding the phenomenon? Now, it is magnet reaction, yes. It is integrated at this point, it is. So there's decorticate, this D. Hi Sharkies, welcome to the stream. False regard, it's not located at this point. Shut up. They said decerebrate. That's not fair. So there's decorticate and there's decerebrate. It makes sense. So midbrain above the red nucleus is decorticate, below the red nucleus is decerebrate. So that also includes the spiral level? I did not know that. Because the midbrain has both of them. Yeah, that this time it trends so fucking bad. Okay, we're done with 60. I think we're done with 60 questions now. 60 or 40. I don't know, I lost track. But it's fun. Ink, numbers, common, problem, image base, recent updates, recent need, investigation, opponent drug of choice, criteria, instruments, slides, clinical, no GIF. Don't ask GIF based in the exam. So, catches next level. Wait. Farmer presents with lucid depression and person dermatitis. On examination, a red beefy tail gets noted. What is happening? So it's not Wernicke's encephalopathy. Hartnum disease? Wait. My brain is not working right now. I think it's paradoxin deficiency. Never mind. It's Wernicke's. What the fuck? Yeah, B6 Pellagra. Not associated. Oh my god, I need to read the question more. I knew there's. I was like, doesn't Hartnum pass this? Doesn't. But it clearly says paradoxin deficiencies answers that. But then I did not read not associated. It fucking said not associated. Not associated. If it was associated, it could be all these three. I need to read the question properly. Which of the following is the most alkaline secretion? Most alkaline secretion. Okay, so gastric is acidic. Saliva is slightly alkaline. It's more towards, yeah, slightly alkaline. Small intestine secretion is alkaline. Small intestine is also alkaline, but okay, most alkaline is Brunner gland. Makes sense. But 7.5 to 8. Brunner's is 8 to 8.9. I see. If there's a zero filtration across the capillaries, what is the intestinal hydrostatic pressure? So zero filtration across the so we're looking at what do they want? Interstitial hydrostatic pressure. Okay, so capillary hydrostatic pressure is 18. Capillary oncotic pressure is 27. We're saying that zero filtration across the capillaries. Interstitial oncotic pressure is 7. So 7 plus 18, 25, 2 plus 2. Nice. What the fuck? Okay, Starling's equation, I'm up, right? That's literally what I used. But I used it in reverse. I fucking used it in reverse. Wait, I need to focus. So it's capillary minus interstitial. What did I do? Wait, I did that. No. Oh my god. Okay. I just did my mistake. I just made a mistake. So capillary hydrostatic pressure, which was 18. So capillary hydrostatic pressure was 18 minus PI, which is interstitial hydrostatic pressure, which was 7, which is 15. Wait, sorry, 11 versus 11, minus the capillary oncotic pressure minus 0, which is 11 minus 27. Wait, what? The net force is 0, so okay, it's 18 minus 0 minus 27 minus 7, which is minus 2. I did the reverse and I got plus 2. Renal plasma flow is being calculated using pH in a patient. The technician advertently uses pH twice at the recommended doses. What will the estimated effective renal plasma flow? Wait, what is pH? What is pH? I mean, the exam they don't usually. Okay, pH clearance. Okay. Character is not affected. Full stilo. I didn't know. I completely forgot about this topic. Holy shit, I'm so thirsty. I'm so damn thirsty. So effective renal plasma flow is pH urine, pH in the urine into urine flow rate by pH in the plasma. So now we have so pH is 3 times the dosage. And they're asking what is the effective renal plasma flow. So you have to do so of course if he injects it 3 times, so the plasma should considerably rise, so that's by 3 pH, which should be falsely low. Makes sense. How many amino acids are encoded by the genetic code? 13? 20. That wasn't really thinking. The predominant organ producing insulin like growth factor 1 is the pituitary. Liver? What is wrong with me? Somatomedians, what is wrong with me? Okay, vessel this again. Oh my god, we're just getting every question wrong at this point. Vessel A has a length of L and diameter of D, and vessel B has 2L and 2D. Considering that flow is laminar in both the cylinders, the flow through B is how many times that much of A? So 4 times. 22, 4. 8 times. How? So Poisson-Hagen's law, pi by 8 into what? Nope. I hate physics. Oh, this is a tendon pair, distal tendon of proximal tendon of biceps. Never mind. I do know it's a tendon of biceps break high, but I was not thinking if it's distal or proximal. During the examination of a patient, a professor inverts his foot and points to a prominent tendon locating behind the medial malleolus. Which tendon is it? So it's behind the medial malleolus, third malleolus posterior. Finally something. A 10-year-old boy rapidly develops hypoglycemia and moderate activity after moderate activity. Blood examination shows raised low ketone bodies. Okay, the liver and kidneys are found to be enlarged. This apparently liver shows deposits of glycogen, and so there's a glycogen storage disorder following heavy activity, which is likely myocardials. Never mind what grades. Okay, Deposits of glycogen in the liver. Mechanism muscle because I thought fatigue. Oh my god, I need to read the question properly. 1 Qbanks is liver glycogen disorder. Now, a cardiologist doing an AV node ablation procedure for AV and RT, which while looking in the AV node, look for all the following landmarks found in its boundary except tendon of Tadaro, yes. Septal leaflet of tricuspid, posterior leaflet of tricuspid valve. Next, I'm good at anatomy. I'm pretty decent at anatomy, but when it comes to physiology and biochem, oh god, save me, please. Okay, the weakness. So the previous this fucking question mark is asking everything about biochem and physiology. I hate. 16-year-old girl presents with complaints of severe muscle cramps, weakness, and fatigue after exercise. Laboratory investigation with elevated reticulocyte count and indirect bilirubin. So 16-year-old elevated reticulocyte, so unconjugated bilirubin, mild anisopoikilocytosis without Heinz bodies. There's no Heinz bodies. So what are we looking at here? Muscle fructose 1 deficiency. Yeah. So it's thyroid. It's thyroid disease. They clearly said that poor exercise intolerance. So yeah, it's pretty much muscle PFK1 disease, which is thyroid. Let's look at the other options. Did they mention anything about the other options? They did. So G6PD deficiency should have Heinz bodies, which is why I did not take the G6PD deficiency. Pyruvate TEDis, yeah, there should be 2T3-PPG, RBC lysis. You usually don't have to have myopathy in it. Hexokinase, yes, muscle is affected. But yeah, if hexokinase is affected, then muscle has other ways to derive, so it should not be much problem. Next, which of the following is a false rib? 7th and 8th. Sorry, the last one is the false rib. That's I remember. 8th to 10th is a false rib. 11 to 12 are false rib. Why did I take 7? A child presidency with bone pain, hepatitis plane. I don't use my brain sometimes. I just shut off at night. Trephine biopsy aspartate shows the following finding. Guys, by the way, I think I'll end the stream early tonight, and we are gonna stream early tomorrow, so that we can study more. Also, probably because I want to play NT a little. I do not finish my dailies. A child presents to you with bone pain, hepatitis B, and pancytopenia. A trephine biopsy aspirate shows the following finding. Which of the following enzyme deficient in this patient? No idea. What the fuck? So okay, let's think it clearly. Patient has bone pain. Patient has hepatosplenomegaly. And pancytopenia. So you do a trephine biopsy aspirate showing the following finding. So this is similar to what we saw before. So what is most likely enzyme deficient? So we are likely looking at Gaucher's where glucocerebrosidase is affected. This is what I told. Previous mistakes are this time's correct answer if we fucking read properly. Identify the level of cross-section shown in the following image. So what do we have here? This is the lungs. You can see a good cut section of the lungs. You can see the I think wait. So this is the esophagus, this is the trachea. So we are likely still talking about the thoracic inlet. You can see this is the arch of air. Is this the arch of air? Wait. I think this is T2 to T3. I'm at T2 to T4. I was right about everything. I was just wrong about the answer. Look at this. I was literally right about everything. I said this is the arch of aorta. There's likely tracheal bifurcation. So that's T2 to T4. That's the fucking thoracic inlet. Right, it is thoracic inlet, right? Just before I make a fool out of myself in the exam. Thoracic inlet. No. Oh, it's fucking AI. So T4? Okay. I was wrong about thoracic inlet. No. T4 is a bifurcation of trachea. T4 is a bifurcation of... yeah, T4 has a lot of bifurcation. T4 has also the arch of aorta. So the answer has to be T4. I did not think it through properly. I was right till the answer. I was right till the level. Why am I getting a GIF? Found to have inflammation of the muscle marked below. I did fight. Patient is having sciatica. So it looks like... So let's see. It's not gluteus minimus because gluteus minimus is supplied by the superior gluteal nerve. Quadratus femoris is not quadratus, it's piriformis. That small muscle, it's piriformis. I was taking a bit too much, which was unnecessary. Which of the following enzymes are involved in gluconeogenesis? So you have gluconeogenesis. Which of the following enzymes are involved? What's wrong with me? I froze. Yes, pyruvate carboxylase, yes. PP, no. I think just A and E. It's on A and E. The number of muscle fibers per Golgi tendon is, I don't fucking know, 200 to 300 numbers, 30 to 20. I don't know the numbers. I don't know numbers. 53-year-old man presented with hematemesis. I'm honestly going to skip numbers in the exam as well. 53-year-old man presented with hematemesis and ascites. Investigation revealed the presence of a tumor at the portal hepatitis causing portal hypertension. Which of the following is least likely to be involved by the tumor? So there's a tumor at portal hepatitis. Portal hepatis causing portal hypertension. Which of the following is likely to least likely to involve in the tumor? Hepatic artery vein duct, not the nervous plexus. What? Okay. You're right. Hepatic veins do not enter or exit the portal hepatis. It's just the portal vein and hepatic artery. I forgot. And the lymphatics. I forgot. I did not know this. I did not know the nervous plexus was involved there. It just was instinctive. Which the following diary in a diagram is a solid line is the original fluid and dotted line is the change caused by the condition. So this is a shift. From the ICF to ECF. So as we can see, there's reduced ICF. So reduced intracellular fluid is caused by, let's see, diarrhea, excessive setting causes reduced extracellular, so you can eliminate both of those. Adrenal insufficiency and SI-ADH, both act really opposite. So SI-ADH syndrome of inappropriate ADH secretion is likely the answer. And I was wrong. I'm so confused. SI-ADH... Wait, doesn't SI-ADH cause increased... Okay, I was... Lost my ECF volume decreased because low volume. ICF osmolality decreases. Oh my god. I'm stupid. Yeah, we're just deteriorating now. We're just fucking deteriorating. Yeah, I think, so this is probably our 100th. With this, we would have finished 100 questions. And we'll just continue tomorrow again. So my main target is, so we have 7 days. We have Monday, Tuesday. We have 6 days. We still have 7 days remaining from tomorrow. So my main target is 1 full day for anat biochem physio because I'm really weak at that. So that's generate 6. Let's make a fucking notepad. Wait a second. Where's my notepad? So tomorrow is Sunday, right? Tomorrow is Sunday. Sunday we have anat first year. Let's write first year. Monday we do all your second year. Then we have Tuesday we do specifically for ENT and Opta. And Wednesday entirely for SPN because SPN and forensic. Now we have Thursday and Friday and Saturday. So Saturday is the deadline. So Thursday, Friday. Let's see how do we divide this day. So let's put an entire day for medicine, which is likely to be Friday now. Okay, the plan is like this. Thursday we involve OG surgery and a little bit of ortho. Friday is for medicine and the rest and minor subjects, medicine and every other minor subject. Saturday is for weak points and bad subjects, and which I'm bad at. And night is rest. So this is the schedule. Tomorrow we are just gonna focus on the first year subjects again. Monday we're gonna do second year subjects. Tuesday we're gonna do EAT and off-tau. Wednesday we're gonna do SPM and forensic. Thursday we're gonna do OG surgery and ortho. Friday I think we'll shift ortho to Tuesday because ENT off-tau is okay-ish for me. I'm not good at it. Ortho I'm kind of bad, but a little bit of revision would make me pretty much good. So Tuesday I feel good about Tuesday. ENT off-tau. Wednesday I want to focus a lot on SPM and forensic. Thursday OG and surgery, very important, very big subjects. Friday medicine and other minor subjects. Saturday is for weak points and bad subjects, and Sunday is the D-Day. And Saturday I'm not gonna do a night stream because I want to sleep early, and yeah. So we're likely to end the stream early today, and because tomorrow we're doing the same subjects again. Which of the following is true regarding the given cystometrogram? So we're comparing the volume to the pressure. It's true regarding segment 1A is due to residual urine. That's false. Segment 1B is due to Laplace law. Maturation fails to happen in segment 2. That's false. Dotted line represents that maturation has occurred. Yes, and represents the... No, wait, what? No. Dotted line is not... Look at the volume. Volume is increasing. 1A is where... Wait, 1A could be the residual urine? So 2 is for the pressure. So we are at 400. Nutrition fails to occur. B is correct. Laplace. There are lots. They're very specific on the B. Laplace, so it has to be B. So pressure is equal to twice the volume of tension by radius. Sakaguchi test is answered by... What the fuck is Sakaguchi test? Amino acids. A student had his jaw locked while yawning. Which of the following muscle is attached to the articular disc of the temporomandibular joint? So there's a locked jaw. Let's see. So the mandible is depressed. Okay. I actually try to figure it out. Give me a second. So, which muscles causes elevation? Which muscles cause depression? But they're not even asking that. So, lateral triangle and medial triangle both are attached to the temporal mandibular joint, no? Temporalis is also attached to, I think, the masseter or my lateral trigard. It's attached to the lateral surface of the lateral trigard plate. That is attached to the TMJ. Oh my god. I'm stupid. I thought which does not attach to the TMJ. I'm stupid. Okay. And unilateral trigard attaches to the TMJ. That's why I didn't take it. Literally what I said on the stream. Which of the following has the greatest effect on plasma osmolality? Greatest effect. Vasopressin. Which of the characteristic enzymes present in peroxisomes? Glycosidase, never mind, catalyst. Where best glycosidase? Nowhere, everywhere. Okay, next. So, patient with paradoxical respiration, which of the following nerves is likely to be affected? I'm so sick of it. Okay, this is the vagus nerve, paradoxical respiration. So this is the 1 second. So this is vagus, and here you can see is D is the phrenic nerve, C is the external recurrent lanyard. So answer is D. Yeah, I was right, phrenic nerve. So you see the vagus is here, and then there's a branch coming out. So this is the phrenic nerve, which goes anteriorly and goes to the diaphragm. Whereas these are RLN, recurrent lanyard, coming up from the vagus and going up. Whereas the phrenic nerve is what is affected in paradoxical respiration. A neonate has brought with features of lethargy and poor oral intake. On examination, a cataract was seen. Urine Benedict test was positive but negative for glucose. What will be the enzyme deficiency in the... So there's no glucose in the urine. So we're unlikely talking about hexokinase or galactokinase. Wait. We're not talking about hexokinase here. But the Benedict test was positive. There's a cataract seen. The answer is galactokinase. Wait. My dad just talked about this. I was just discussing with my dad about this like 2 hours ago. Dieters 1 phosphate uridyl transfer is a classical galactosemia galacto. Why did I take galactokinase? Oh my god. Third part of vertebral artery is related to which of the following? So the third part is where this anterior spinal artery, this middle and posterior spinal arteries. So we're likely looking at 4 or 1. I think it's 4. It's 2. Wrong. I know the branches. I know the branches. I know the fucking branches. So there's V1, V2, V3. V4 is just it goes up, so it's not related to any of this. Third, V3 is related to marked area 2, which is to the transverse process, okay? Wait, now. Posterior arch of the atlas. Yeah, I need to give it a detailed look later. I will just see the explanation later. It's gonna take a while for me to read. I'm a slow reader. I'm a slow reader when it comes to trying to remember it. Activation energy is the free energy difference between activation energy. Activation energy is the free energy difference between substrate and the product. Substrate and transition state? No, substrate and the product. Substrate and the transition state. Oh, activation. Oh my god, I need to read it properly. I need to read the question. It's literally the question. The answer is literally in the question. Activation energy. So what do you need to activate? So it's the difference between the substrate and the transition. The total energy, however, is the energy and activate. Oh my god. I need to read the question more. The man complains of bluish black discoloration of the sclera and pinna for the last 6 months since childhood. His urine turned black when standing. Which of the following is a probable diagnosis? Black urine disease, alkaptonuria. Deficiency of homogenetic acid, oxidase. So there's alkaptone bodies. Okay, yeah, we got it right. Which of the which movement range is increased at glenohumeral joint due to lateral rotation of the humerus? Lateral rotation of the humerus. You have abduction. Okay, just do it on. I was just doing it on my hand. You're asked to do thoracocentesis for a patient with mild pleural effusion on the left side. You are being cautious. When setting a needle in the left mid-axillary line to the patient, you will not insert the needle below. Damage below the 6th rib. 10th rib. You're doing the 4th to 5th rib. I did you doing the 4th to 5th rib. So I assume anything below the 6th rib you're not supposed to do. So you're not supposed to do below the 10th rib, okay. So look, oh wait. Huh? You punctured the lung, yes, but you also punctured the lung from the below the 6th rib. Imagine the patient inspires. The diaphragm is pushed up, the lung border pushes up to the 6th rib. You're gonna go smash the 6th rib? Dude. That question is faulty. A 70-year-old man suffering from prostate cancer is undergoing long-term androgen deprivation therapy. He is being treated with long-acting GnRH agonist. After prolonged injection of the GnRH, which of the following will most likely be seen in the patient? So we have prostate cancer, undergoing long-term androgen deprivation therapy. He's treated with long-acting GnRH. So what is the likely you see in this patient? We are talking about so it's androgen deprivation therapy. Spermiogenesis should likely decrease. FSH should decrease as well because of that. Test. Androgen deprivation therapy, the LH answer is B. It's obvious. A person with normal lung at sea level is breathing 50% of oxygen with a normal respiratory quotient of 0.8. What is the approximate alveolar PO2? How do you calculate it again? I don't know how to calculate it. 0.8, 50%. So he's breathing 50% oxygen with a respiratory quotient of 0.8. I don't know. So I'm trying to do something. She not 6, 159, I think not 6, okay. Let's see how they did it. So we know the PiO2 is the PO2 in the inspired air, which is 50%, which you take as 0.5 minus PCO. Yeah, this okay, 47. So you take 47 mmHg you take. So 0.5 into, so first you calculate the PiO2, which is 0.5 into, which is PiO2 is equals to FiO2 into PP minus pH2. So 0.5, which is what they said, which they gave the value as 50%, which is 0.5 into 760 minus 47, which is water pressure. So 0.5 into 713, it gets you 56.5. Now we calculate the PiO2 using the formula. So what we got 360 or 56.5 minus PCO2 we take as 40 standard by the coefficient, which is 0.8. So the answer is 356.5 minus 50, you get 306.5. Let me just quickly screenshot this as well. Find the incorrect match. Bruh. RAF nucleus serotonin. Okay. Basal forebrain complex GABA. Okay. Histamine hypothalamus. Locus is not a perfect. Histamine hypothalamus. Never mind GABA. Serotonin RAF nucleus. I know that. Norepinephrine locus ceruleus. I know that. Acetylcholine is nucleus basalis, and dopamine is substantial. This one, dopamine substantial right now. Okay, acetylcholine, basal forebrain complex causes Alzheimer's. Oh my god. Why am I speaking like this? A resident was inserting a central venous line through the femoral vein. He accidentally injured the structural medial to the femoral vein with the femoral sheath. Which structure is likely to be injured? Of course, the femoral nerve. Lymphatic vessels. Oh my god. So the vein artery nerve line medial to the femoral vein. Right. The nerve lies outside the femoral canal, but it still lies medial to the femoral vein. It just lies outside to the femoral canal. So I'm not technically wrong, but yeah, you injure the lymphatics if you say immediately to the next to the femoral vein, but you can also injure the femoral nerve. Which are the effects of the posterior lesions in Broadman area 22 in a stroke patient? So we're talking about the inferior frontal region, which is repetitive expressive speech function. Repetitive, you can't. Yeah, repetitive speech function. Right, in case you okay. All the following are products obtained in the uronic acid pathway in humans except. Products obtained in the uronic acid pathway except vitamin C. You don't have vitamin C in humans. You have to take it externally. A 65-year-old man was admitted with generalized weakness, easy fatigability, itching, and jaundice since 1 month. On examination, okay, he was emaciated and had scratch marks all over the body. Looks like alcohol. A mass was found in the upper abdomen, which of the following can seen on Van Berg reaction? What is Van Berg reaction? Positive? Direct positive? So it's just alcoholic liver disease. But yeah, direct obstructive jaundice, because they mentioned jaundice. So we are talking about obstructive jaundice here. So you have Van Berg reaction, which is yeah, it's Van Berg reaction is direct positive for obstructive jaundice. Hepatic jaundice, you have biphasic, and unconjugated, you have indirectly positive. Negative for normal. Which of the following are macrophages present in the mesoderm of chorionic villus? No idea. Langerhans cell, it's not Langerhans cell, I know that, because Langerhans cell is not seen in chorionic villus. Nidhabrushal, Hofbauer cell sounds something. That would likely, that is. Hofbauer cells are fetal-derived macrophages present in the placenta. Yep. So not that bad. Okay, 55%. Not too bad. Not too shabby. Well, there were a lot of questions I would have left and I got it wrong, so still not too shabby. I think we'll go for one more and then we call it a day. 120 questions. Because it's still too early to sleep. I'm just not used to sleeping at this time. But I do have to do my tea dailies. Oh my god, it's just gonna... But I feel like it's a really short stream then. But yeah, I don't know. I don't know. Let's do 10 questions and call it a day. 10 questions. The last 10. I just feel I like solving MCQs. Even though I was supposed to do it every day and I just did not. Extracellular concentration of positive ion with valency 1 is 100 millimole and intracellular concentration is 10. The potential across the membrane is minus 60 plus 60. Okay. I hate these questions. I hate these questions. A 6-year-old woman was died. You give me any amount of anat questions, I'm really happy with it. You give me a physiology and biochem, I'm gonna cry. A 6-year-old woman was diagnosed with papillary PDC. Study was formerly made in India showing metastatic deposits. Which of the following structures will not be visualized in the medial mediastinum? So middle mediastinum, let's see what do you have. You have the superior vena cava, yes. You have the ascending aorta, yes. You have the pericardiac phrenic veins, yes. You have the left recurrent laryngeal nerve, no. That's in the superior mediastinum, too basic. Which is the most common and stable conformation of a polypeptide chain? Most common and stable conformation. Beta updated. Alpha helix, okay. Ah, van der Waals and hydrogen bonds, okay. Bitotsport, vitamin A, simple, next. Patient present emergency department with severe abdominal pain, nausea, and vomiting. The laboratory results show serum triglycerides more than 2000, which deficiency could be contributing to the patient. So triglycerides level is increased, so that likely there's no binding of the triglycerides. So I don't know. I put BC2. Yeah. Okay. Yeah. B48 is Kylo, B100 is LDL, A1 is HDL. Okay. Yeah. ADH leads to secretion of concentrated urine in all of the following mechanisms except ADH leads to secretion of concentrated urines, increases water permeability in the collecting duct, increased absorption of urea from the descending loop of Henle, increased reabsorption of sodium from the thick ascending loop of Henle, and increased absorption of urea from the medullary collecting duct. I think it's C. Okay, it's B. Because of, I thought of B, but then I looked at C, and then I was like, isn't more dilation and ascending loop? And then I forgot you have the active pump. Oh my god. The space of the C consists of all the following except plasma, fat cells, for heat pain fibers are stimulated at temperatures around heat pain, so 45. Identify the cell marked in the histological image of the cerebellum shown below. What's the... Oh my god. Golgi looks Golgi-ish. I'm gonna go with Golgi. It's Purkinje. I knew I would go wrong here. So it's a Purkinje, which is flower shaped. Yeah, I need the picture of this as well. These are like silly mistakes I make, honestly. I don't think. I either think too much or don't think at all. The needle is inserted with a particular space to withdraw CSF in a ratio L3 to L4. What? At which level does a space terminate? I did not read the question fully. Sounds right. L3 to L4 is very good, but at which level does the question was? At which level does it terminate? It terminates at S2. Oh my god. This is what you say when you're inting on purpose. Yeah, I think I'm done for now. Thank you so much, guys, for joining my stream. And I will continue tomorrow day. I did not mention my schedule, but it will happen. So thank you so much, and see you guys tomorrow. Matane.